Hello, good evening. My name is Dr. Chudi Ufundu of Snowspirations Global Health Solutions. Welcome to Open Clinic with Dr. Chudi on YouTube. Today we're going to talk about how to achieve pregnancy despite your irregular period. If you're currently having irregular period, it means you can't really pinpoint your cycle. You can't really pinpoint when you will bleed. You can't really pinpoint when you ovulate. Irregular cycle, it's very confusing. Some women might not be able to, know exactly when to open their fertility window. So what we're going to discuss this evening are basic steps. I'm going to share with you 4 applicable practical steps you can take in the month of September to improve your chances of becoming pregnant despite your irregular period. So when you have irregular period, it simply means you are not within that range. So the range of regularity stems from your cycle. Let me use my teaching aid to illustrate. So this is my teaching aid. This is the female internal reproductive system. When you have a regular cycle, it means every 21 days you bleed, or every 25 days you will bleed, or every 35 days you will bleed. 21 days is the lower limit of normal. 35 days is the upper limit of normal. So if you have a regular 21-day cycle, it's normal on the lower limits. If you have a regular 35-day cycle, it's normal on the upper limit. However, the commonest cycle out there is 28 days. So majority of women will bleed every 28 days. Now, the normal duration of bleeding is from 2 days to 7 days. So some women can bleed for 2 days, some women can bleed for 5 days, some women can bleed for 7 days. They are all normal. It becomes abnormal when you bleed only for 1 day or when you bleed for more than 7 days. Now, when you know your cycle, you can conveniently plot the likely period you will ovulate. If you can know your cycle and you can plot your ovulation time, if every other thing is taken care of, then you can know your fertility window. When you know your fertility window, if you narrow the lovemaking episode within that fertility window, you will likely become pregnant. This is in a situation where you have regularity. But what we obtain as of lately, it's irregular period. So if some months you are 45, some other months you're 60, some other one you're 20, some other one you're 15, is all over the place, it will be difficult for you to practice any timed lovemaking. You are not supposed to time it. So what I'm going to take you through this evening is to give you the steps you can actually apply so you can overcome this challenge. So the fact you have a irregular period doesn't mean you can become pregnant. You can still become pregnant, but there are certain things you need to do differently. And I'm going to help you to take those steps this evening. So thank you so much for coming. I'm planning to spend about 20 minutes. So I'm going to give my presentation for 10 minutes. Then I'll use the other 10 minutes to take care of your questions. Number 1 step you can take as from today is to modify your lifestyle. You see, your lifestyle will mirror your fertility. If you have a healthy lifestyle, possibility your fertility will improve is very high because the guiding factor in fertility are the hormones. So if you have a very healthy lifestyle, possibility your hormones will be regular, it's okay. Possibility your hormones will be normal, it's okay. When your hormones are normal, like your estrogen, your progesterone, your follicular stimulating hormone, your luteinizing hormone, your thyroid hormones, if all these hormones are mentioned, which are the key reproductive hormones, are normal, then they will guide the release of your eggs, which is ovulation, which is an event that must happen before you become pregnant. For example, if you have normal level of estrogen, if you have normal level of progesterone, if you have normal level of FSH, follicular stimulating hormone, at the middle of your cycle. So for example, if you have 28-day cycle, by default, when we minus 14 from 28, we're going to have 14 days. So expectedly, From the first day you started bleeding, if you count 14 days, it's expected that on day 14 you will bleed, you will have your ovulation. Now, before that ovulation, there's a particular hormone we call luteinizing hormone, which is more like the forerunner, which will surge, it will go up. When it goes up, within the next 24 hours, you will ovulate. Meanwhile, before then, the follicular stimulating hormone would have started developing one follicle in the ovary, which will become the dominant follicle. The dominant follicle is the follicle that contains the eggs that will be released. The process of releasing the egg is ovulation. This is for normal people. Now, for you to modify your lifestyle, you have to improve your general overall health. Your general overall health will affect your fertility. And I'm going to tell you steps you can take. Very basic, simple things you don't even know might affect your fertility. You see cigarette smoking, run from them. There are two types of cigarette smokers: primary smokers and secondary smokers. Primary smokers are people that go lighting the cigarette themselves. Secondary smokers are people that hang around people that smoke. Avoid them, both primary and secondary, especially for women. I can see some people say, but women don't smoke. You're joking. Women smoke lately. Avoid the raw smoke, avoid hanging around people that smoke. Now, personally, if you ask me as of today, if you're really believing to become pregnant in September, discontinue your alcohol consumption 100%. Stop alcohol completely. Eat healthy, balanced diet. Your food should comprise of fruits, vegetables, whole grains, your lean protein. Get your protein from plants. Drink a lot of water. If you can do this consistently in the month of September, you would have improved your health by eating balanced diet. When you eat balanced diet, your body will function according to the original plan. Now, you have to put in moderate exercise for at least 30 minutes. Avoid excessive exercise. Of course, take your prenatal multivitamins, focusing on folic acid and CoQ10. These are important components in that multivitamins that will help your body to function optimally, so that eventually when you become pregnant, your baby will be fine. Number two, because you can't use the conventional method of knowing if you're ovulating. So what are the conventional methods? You can use your increase in basal body temperature. When you wake up in the morning, when you wake up from sleep, the very first thing you will do before you get out of bed, you check your body temperature. We notice that shortly before ovulation, some women will have a drop in their temperature. Then immediately after ovulation, it will go up again. You can use that traditionally, but because we don't know exactly what's going on in irregular cycle, it will not work. Now, some women can also notice increase in cervical mucus when they are also ovulating. Unfortunately, based on your irregularity, it cannot be a good indicator. So the best bet to track your ovulation, if you have irregular period, is to get ovulation predictor kit. Your ovulation predictor kit is actually checking the LH hormone, luteinizing hormone. So it's expected that when the ovulation predictor kit notices a rise in LH, within the 24 to 48 hours of the LH going up, you're gonna ovulate. So we'll recommend you get over-the-counter ovulation predictor kit. It's much better than waiting for the conventional, oh, you have increase in your cervical mucus, your temperature is up and all that. Get ovulation predictor kit so that you can target when you're likely ovulating. But regardless, for the month of September, whether you know you're ovulating or not, whether you know it's your fertility window, we generally preach increase in frequency of lovemaking. So long as you're not bleeding, or even if you're bleeding, there are some few women that will become pregnant when they make love during their bleeding because they have a short cycle. So increase the frequency of your lovemaking. That's my number 3 point. The more you make love, the more you deposit fresh sperm in the vagina and the cervix, the more they will be available to fertilize the egg. Remember, you have irregular ovulation. You have irregular fertility. Everything is irregular. So if you don't have availability of sperm, pregnancy is not going to happen. But if you continue to deposit fresh quality sperm in the vagina, anytime the eggs decides to show up, you will get the egg fertilized. So that's the essence of increase in frequency of lovemaking. Now, finally, you have to work on reducing your stress level. You see, stress and anxiety are the biggest enemy to fertility naturally. When you're stressing, you're increasing a lot of your cortisol, which is the stress hormone. When you have a lot of anxiety, you won't even have libido. You will not be settled. Your hormones are going to be playing tricks on you. So reduce your stressors, reduce your anxiety. How can you do this? You can learn some stress management and techniques like deep breathing and meditation. You can go to the gym. The more you gym, the more you exercise, the more you're going to release anti-stress hormones, which we call endorphins. Endorphins are going to give you high feeling. And when you have high feeling, you will feel better. When you smell, you feel better. When you shower, you feel better. And you will be able to engage your partner. Now, you also have to sleep. Sleeping better will also help you to improve your anxiety and your stress. So it's recommended you get, worst case scenario, 7 hours sleep. The maximum is 9 hours. So if you can get 9 hours, better. But worst case scenario, get your 7 hours sleep. Now, finally, if you know it's not working, if you know that everything I'm telling you is actually not applicable to your own situation, then you need to see a fertility specialist. Especially if you're older than 35. The earlier you see a fertility specialist, the better. So this is the 3-4 ways you can use to overcome irregular bleeding, irregular cycle, irregular ovulation, irregular menstrual cycle, so you can still become pregnant for the month of September. Now, what I'm preaching now is more applicable to women that are above 35 because you have more challenges. When you are above 35, you have fewer eggs, and out of those fewer eggs, few are of good quality. So you will struggle more compared to a woman in her 20s who is having irregular bleeding. A woman in her 20s with irregular bleeding can easily become pregnant compared to a woman in her 35 and above who is having irregular bleeding. Why? Because you have fewer eggs. And out of those fewer eggs, there are fewer quality. So the older you are, the more you have to make love. The older you are, the more you have to avoid stress. The older you are, the more you'll have to avoid anxiety. Unfortunately, it's the other way around. The older we are, the less sex we have, the more anxiety we pile up, the more stress we pile up, the less sleep we get. But you are actually supposed to get the opposite to increase your ability to become pregnant. So that's my presentation. I hope it will make sense to you. And I want you to share this particular video with anyone out there who might probably be having irregular period. It's very simple. It works like magic. So share it with them. Before you leave today, click on the notification, subscribe, so that next time I will come live in YouTube, you will be there. My next video in YouTube will be on Saturday. Saturday will be 3:30 p.m. Eastern Time, 8:30 p.m. Nigerian time. But right now, I'm going to give you an opportunity to ask me questions. So please feel free and ask your questions if you have any. Okay? All right. Remember to register for the big event coming up on the 24th, our masterclass on multiple pregnancy. If you desire to have twins, triplets, quadruplets, this is your opportunity to improve your knowledge. When you acquire the sound, cutting-edge knowledge, you're going to improve your attitude. When your attitude is improved, likelihood you're going to practice better. When you practice better, your perception will change. So if you combine your knowledge with your attitude and your practice, you will defeat infertility. So make sure you attend that event. It's going to be on the 24th. 9 p.m. Nigerian time is by registration, and we have only 100 slots. So if you want to end your infertility with twins, triplets, and quadruplets, which is possible. Yes, you can be a twin mother. You can be a triplet mother. You can be a quadruplet mother. It's not impossible. It's possible. Even when you don't have family history, what you need is the knowledge. We'll give you the knowledge. You apply the knowledge. You take your bold steps, and by the grace of God, you will overcome. So let's talk about your questions, okay? COO, thank you so much for preaching the upcoming events. So your cousin is on fertility pills for 3 months. So what about that? Will she be able to get pregnant after 3 months of fertility medications? So my sister, you see, fertility is not a one-size-fits-all. Fertility is customized. So I don't know the particular condition your cousin is going through. I don't know the name of the drug they gave your cousin. I don't know the condition they are taking care of. I don't know the age of your cousin. I don't know the medical history. I don't know if your cousin is having infertility of primary origin or secondary origin. So there are so many things I need from your cousin before I can hazard a guess. But guess what? If your cousin is doing the right things and your cousin is consulting a fertility specialist and they placed your cousin on treatment for 3 months, 3 months is a long time for your fertility to improve. But this is what I will tell you. Sometimes fertility treatment will not work. If it doesn't work and time is not on your side, activate, think outside the box. For example, if you're in your 40s and we probably challenged your ovaries by giving you ovulation induction drugs like Clomid, and after giving you Clomid or maybe letrozole and it's not working, Will you start gulping Clomid for the rest of the year? No, we're not going to do that. A good doctor will not do that. A good doctor will advise you to start with at least IUI. So we can combine your IUI with your natural cycle, or we can induce you and combine your IUI. So in IUI, what do? We collect the sperm. We introduce the sperm directly into the uterine cavity to give it a closer range to get to the tubes. We can use your natural ovulation if we confirm you're ovulating, or we can induce your ovulation by getting super ovulation. Super ovulation is always superior to natural ovulation, because when you're going to super ovulation, we are collecting more eggs. And when we collect those more eggs, we handle the eggs by our own way. Now, you can also go for IVF, or you can also go for surrogacy, or you can also adopt. So there are so many ways you can arrive at this. Okay? So you need to talk to your cousin. Make sure your cousin is doing the right things. But ultimately, yes, you can. And yes, she can, especially if she's younger than 35. There is nobody in this community that can be a mother. There is nobody in this community that can be a father. But not everybody will become pregnant to become a mother. Not everybody will become, we inseminate a woman to become a father. There are so many other ways you can achieve fatherhood and motherhood, despite the fact you might not be able to carry the pregnancy by yourself. And they are all the same. There is no difference. Okay? All right. Keep asking your questions. Okay. Here we go from COO. How can a woman with irregular cycle track her ovulation? Ovulation predictor kits. That's my recommendation. They are sold over the counter. They are not 100%, but they can help you to get a little bit of accuracy compared to your traditional way of checking your temperature or checking your cervical mucus. So go to any good pharmaceutical outlet out there and buy ovulation test kit. Ovulation test kit is going to check the level of LH through your urine. Once you notice that the LH level is rising within 48 hours of peaking, then likelihood you're going to ovulate is very high. And when you ovulate, possibility of pregnancy is very high. Yes. And you can also see, guys, you can also track your cycle by yourself. So some women might have regularly irregular period, and some women might have irregularly regular period. So if you plot your own graph, how can you do this? You can get a map, you can get a plain paper, or you can put in your phone from January. If you remember your days, which I expect you to know. Every woman of childbearing age should know her bleeding days now. You should know when you bled last month. You should know the number of days you bled. You should know if it's lighter. You should know if it's heavier. You should know if it was painful. If you know if it was less painful, you should know this as a woman. Now, if you go to January and you mark the first day you bled in January, and you come to February and you mark the first day you bled in February, and continue marking it up to September. So from January, February, March, April, May, June, July, August, September. If you go and mark the first days you bled in those months, then you can also go and mark the last day. So assuming your regular is 5 days, you started bleeding on the 2nd of January and you stop bleeding on the 8th of January, then you come to February, you probably started bleeding on the 3rd of February and you stopped on the 12th of February. You can put all those dates in red so that it will be easier for you to plot. Now, when you have plotted in 2 days, just 2 days is all I need from you. First day and the last day. First day and the last day. When you get to September, if you've already bled in September, or you're gonna bleed, once you target September, the last day in September will be the last day you stop bleeding. Now you can comfortably calculate if you have a regular cycle or not. How will you do this? If you count from the first day you bled in January up to the day you started bleeding in February, that's your first cycle. The second cycle will be from the first day you bled in February up to the first day you bled in March, your second cycle. Your third cycle will be from the first day you bled in March up to the first day you bled in April, your fourth cycle. So when you have done this, if you have a likelihood of 28, 29, 30 days, it's regular. How is it regular? You find their averages. If you have 21, 22, 24, it's regular. How do you know? You find the average of 22, 23, 24. That's your cycle. You have a regular cycle. But if you noticed that from January to February was 65 days, which will actually overlap. And the next one actually messed the whole month up. So you can't even do it monthly, because once you've gone beyond 30 days, you've messed the whole month up. So if you have like 65 days, 20 days, 35 days, 15 days, sometimes 10 days, it's irregular. You are not supposed to time your lovemaking, because you're not going to get pregnant that way. This is the best way you can help yourself to track your own cycle while you're making love every day. Okay? All right. Keep asking your questions. It's not only COO that is in the clinic. If we have more people asking their questions, we can aim to go beyond 20 minutes. If we no longer have questions, then I'll end the clinic at this juncture. Remember to join me in Facebook immediately. Now, you have to be a member of our community health page in Facebook. Our community health page is where a lot of new things are happening. So if you're in our major page in Facebook, but you're not in our community health page, then you're not our community. You're not a family. Our community health page is our family meeting. So make sure you join our community health page. Subsequently, starting from today, every Tuesdays and Thursdays and Mondays, you guys will see me in our community health page by my lunchtime. Then for my traditional clinics, which is Wednesday, Friday, Saturday, and Sunday, will be on the main page. Thankfully, the community health page can cross-post to my timeline, to our major page and our group. So anywhere you choose to be, you will still see me. So make sure you go and follow our community health page. Very important. Okay? So do we have any other question? If we have any other question, please ask. We have 10 people in the clinic. If you're a medical student from Afromedics, make sure you ask me one question, at least I will recognize you. But if not, COO, okay, COO has a question. What can cause one's regular cycle to become irregular? Couple of factors. Naturally, as you're getting older, you will begin to notice irregularities. At the extremes of your reproductive phase of life, you will notice irregularities. So what do I mean? If your daughter of 10 years or 9 years just suddenly started bleeding, she's going to experience irregularity. Completely okay. If you are tending towards menopause, you're going to experience irregularity. Completely okay. So age-related factor is number one. Stress, I've already mentioned that. Anxiety, hormonal imbalance, inflammation, extreme sports, broken heart, poor sleep, alcohol, smoking, any of these things that increase in your body weight, decrease in your body weight, eating disorders, anything that affects the way you function as a woman can lead to irregular period. Anything. If you notice, women that are into sports, have you seen any of them suddenly say, I want to go and have a baby? No, because when they go into that active sports phase, everything about them will switch. The only time they will start having babies is when they stop active sports, retire, then start priming their body to recognize that they are women. When you go into overboard in your exercise, your body will be confused. Your ovaries will be confused. They will go into conservation mode. So the type of exercise you need is moderate exercise. When you don't sleep well, when you're adding a lot of body weight, when you're losing a lot of body weight, when you have hormonal imbalance, when you have a recent heartbreak, when you're preparing for a professional exam, all those things can upset your body. And when it upsets your body, you will miss your period and you might think you're pregnant, but you're not pregnant. So the body of a woman is very, very, very delicate. I love that question, COO. Do we have any other question? If you have any other question, please feel free to ask before I go. If not, CO, I'm going to stand by. And if you give me a signal, we can transition to Facebook and we can round off for the evening. It's been a very long day. Okay. CO, are we good? All right. Thank you so much for coming, guys. I will see you guys again on Saturday. Make sure you register for the event coming up on the 24th. And please, if you still have time, join me in Facebook and we continue the conversation. Enjoy your evening and bye-bye for now. CO, thank you so much. God bless.